On June 12th of this year, I wrote a story that examined the growing controversy regarding these designated as provider-based or hospital-based facilities fees, which affect Medicare, its beneficiaries, as well as self-pay patients and patients with private insurance. My story focused primarily on patients with private insurance, and I wrote a secondary piece that looked at the impact on Medicare. I'm going to speak to you today regarding what I discovered in my research, and I'll be happy to take any questions after I conclude my remarks. I first got interested in looking into this issue based on personal experience involving my daughter. She had gone to see a specialist for a medical issue, and I expected to pay a $45 copay. But months later, when I got the bill, I found out I was responsible for $195, $45 for the copay, and $150 that was listed as a clinic fee. I had no idea what that was for. It took several calls, but I was finally able to reach someone who said those magic words, provider-based billing. I had never heard the term before, and the woman on the phone wasn't much help in explaining it to me, so I Googled it. After just a few minutes, I knew this was something I needed to look into as a story. As an investigative reporter, I'm pretty savvy about consumer issues and the law. I knew that if this caught me by surprise, there were others out there who were likely in the same boat. I wanted to make sure consumers were aware of what's going on and what they could do to make sure that they make an informed decision regarding health care. And so I started researching. It didn't take long before I discovered there's a significant controversy over the rationale and fairness of facility fees, which substantially increase the out-of-pocket expenses of patients, as well as the cost to the federal government Medicare program. I also found that many patients like me were hit by surprise because hospitals either don't advise them of the fee in advance, or the notices that are in place are inadequate and confusing. I'll go into that in a little bit, but first, some history. Medicare has allowed hospitals to charge facility fees since 2000. Because Medicare allows the charge, hospitals are permitted to charge it to all patients. Not all hospital systems charge the fees. I found in my area that some did and some didn't. Although the fees have been around for more than a decade, they've come under increased scrutiny in recent years as more and more hospitals are purchasing physicians' practices and clinics and designating them as provider-based facilities. These fees are incurred for outpatient services provided on a hospital's main campus and at off-campus physicians' offices and clinics the hospitals own, as long as they meet certain criteria. Some of the key criteria for that is for the off-campus facilities is that they must be within 35 miles of the hospital's main campus. They also must meet some stricter operating standards that are essentially equal to those that the hospitals operate under. In some instances, the off-campus facilities provide other services available, such as X-ray and lab, although that's not necessarily required. Patients seen at a provider-based facility will get two bills for the same visit. One bill is for the physician's professional services in treating the patient. The second is the facility fee, which is essentially a charge for use of the room. That covers overhead costs like office space, rent, utilities. So what does that mean? The bottom line for Medicare and its beneficiaries, as well as self-pay and privately insured patients, are going to pay more, sometimes significantly more, in out-of-pocket medical expenses. Studies by the Medicare Payment Advisory Commission, or MedPAC, an agency that advises Congress on Medicare spending, found that in 2002, Medicare paid 80% more for a 15-minute visit at a hospital-based physician's office than at a private standalone office. In its 2014 report, MedPAC found that Medicare paid an average of $453 for an echocardiogram that was performed at a provider-based facility. That same test at a private physician's office cost $189. MedPAC estimated that if things did not change, it would cost the Medicare program $2 billion by 2020. Now, these fees impact self-pay and privately insured patients as well, as they are responsible for a portion or a full amount of the facility fee. How much a patient will pay is dependent upon your insurance. For the physician services portion, the patient typically pays the copay for the doctor's office visit. It's a little bit more complex for the facility fee, though. How much the patient will pay will be responsible for depends on their insurance and how they classify the charge and whether or not the insurance company has negotiated a discounted rate for the fee. I discovered in my research that some insurance companies, including my own, classify facility fees as a hospital charge. That means the insurance will cover a percentage of the fee, for me it was 80%, but only after the patient has met their deductible. In my case, we had not met the deductible, and my insurance company had not negotiated a discounted rate. So I was responsible for the entire sticker price of $150. Other people I've spoken to, their insurance company negotiated a discounted rate, which was about 50% of the sticker price. I tried but was not able to obtain information regarding why insurance companies treat the fees differently. I reached out to several insurers, but they either did not respond or gave me vague replies that did not address the heart of the question. So now let's go into the arguments in support and against these fees. I spoke to officials from the American Hospital Association, a trade group that represents hospitals, as well as hospitals from the two local hospital systems in my area that charge facility fees. They offered several key arguments. Among them, hospital-based facilities have higher operating costs. On-campus facilities must be open 24/7 and operate in the emergency room. That's an expense that standalone physicians' offices do not incur. The hospitals must also provide services to all patients, regardless of their ability to pay. For the off-campus facilities, the officials noted that some provide other services, such as labs and x-rays, that cost more to operate. Those facilities must also meet stricter operating standards than a standalone physician's office. For instance, they must meet the accreditation standards of the Joint Commission. And having they noted that having some of those services on campus or at the outpatient facility was a great convenience to the patients, since they didn't have to then go to another place to get a lab. Now, critics of these fees acknowledge all those things, but they contend that in most cases they don't justify the additional cost. They point out that in many instances, patients don't need the advanced services that are provided at some of these places, and that the same level of care can safely be provided in a physician's office at a much lower cost. For instance, in my story, I interviewed a man named Jack Mills, who was seen by a physician who examined his knee for about 20 minutes. He did not undergo any other type of testing at the facility, but was still charged a facility fee. After my story ran, I was contacted by another person who said his doctor required him to come into the office for a visit just to get a prescription refilled. He didn't even see the doctor. He saw a physician's assistant, but he was still charged a facility fee. Now let's talk about the notice, or as I found in cases here, the lack of notice hospitals provide that people will be incurring this fee. Medicare requires that hospitals notify patients that they're entering a hospital-based or provider-based facility and that they may get an additional charge. Officials from the two hospital systems in my area stress that they went to great lengths to ensure patients are notified they're entering a provider-based facility. But my research and personal experience found that quite the opposite, at least in one of the hospitals. Both hospitals said that they post signs at the facilities and also had people sign a form acknowledging that they were notified they are visiting a provider-based facility and what that means. They also had information on their websites, though I found that finding that information took some effort. Neither of the facilities advised patients they are going to be seen at a provider-based facility at the time they make their appointment, however. That was the key complaint of Mr. Mills, one of the patients I interviewed. After I inquired about his case, the hospital system checked, and he did in fact sign a document at the time of his visit attesting he was advised that it was a provider-based facility. There were also signs on the clinic. He doesn't recall any of that, but even if he was advised, he objects to the fact that he was not told the information until he arrived for his appointment. At that point, he was in pain. His only option, if he disagreed with the fee, would be to cancel the appointment and try to find another doctor who was not a provider-based physician. That's a difficult situation to be in when you are in pain. Had he been given the information when he made the appointment, he said, he would have made a more rational, informed choice at that time. In my personal experience, my daughter, who went to a different hospital than Mr. Mills, was never provided any document explaining she was being seen at a provider-based clinic. There was no sign posted in the clinic identifying it as provider-based, although after I researched the matter, I later discovered there was a pamphlet in the waiting area situated with a bunch of other pamphlets that had some information regarding provider-based billing. That same hospital also failed to properly train its staff to answer questions about the fee at least one of its facilities. Stacy Tripp, the other patient I interviewed, said she specifically asked the doctor's office if she would be charged a facility fee when she made her appointment, and she was told no. That turned out to be incorrect. To their credit, the hospital agreed to waive the fee for her. I was also able to get the hospital to waive the fee for my daughter after being able to prove to them that she was not given any notice. Mr. Mills' hospital refused to waive his fee, however. Now, going back to the cost, as you might imagine, the federal government and patient advocates are deeply concerned about these fees. In both its 2012 and 2014 reports, MedPAC recommended Congress change the manner of reimbursement so that the fees charged and services performed at outpatient provider-based facilities were more in line with those at private offices. Congress finally acted on that recommendation late last year when it passed the Bipartisan Budget Act. Section 603 of the Act mandated that the Center for Medicare and Medicaid Services, or CMS, to enact rules that would work to equalize the payment structures. There have been some new developments on that front since my story was published. On July 6th, CMS published a proposed rule enacting the provisions. Under the new rule, hospitals will no longer be permitted to charge a separate facility fee for services performed at outpatient clinics they acquire or construct after January 1st, 2017. The rule calls for physicians to be paid a higher rate under the physician fee schedule, but that rate will be substantially less than what the hospitals are now charging. CMS estimates it will save Medicare $500 million in 2017 alone. Now, the rule applies only to off-campus facilities. Those located in the hospital's main campus that can still charge facility fees. It also does not apply to any existing outpatient facility, all of which have been grandfathered in, or any outpatient facility that was under construction or in the planning phase as of November 2nd, 2015. Those facilities are also grandfathered in. The facilities that are grandfathered in could lose the right to charge facility fees, however, if they relocate or if they expand. That's the key provisions of the promulgated rule. So as you might expect, the changes have been criticized by both patient advocates and the hospitals. The advocates contend that the Bipartisan Budget Act did not go far enough. They're unhappy with the grandfathering clause. But hospitals, meanwhile, contend that the new rules will hurt patient care because hospitals will no longer have an incentive to establish new facilities. That will be particularly detrimental in rural areas. CMS is now seeking formal comments on the proposal, which will be taken up until September 6th. So that's where things stand now. That still leaves the issue out there of what a patient can do if they want to avoid paying a facility fee. The answer is, well, nothing. Federal law allows hospitals to charge the fee. So if a patient does not want to pay it, the only option they have is to see a physician at an office that is not designated as a provider-based facility. In larger metropolitan areas, that won't be so much of an issue, as there are many physicians to choose from. It may be more of a challenge in less populated areas. If this is an issue that's concerned to patients, they should ask the physician's office when they make their appointment if they are a provider-based facility. As the experience of the woman I interviewed showed, there's no guarantee that the answer they get will be right. As a secondary step, patients should carefully review any notices the office has posted on their walls and read documents that they provide that would identify the office as being provider-based. Now, if you know you are going to a provider-based facility, you can attempt, and I stress the word attempt, to find out in advance how much the fee is and what portion of that fee will be responsible for. I say attempt because patients who contacted me after my story ran said they tried to do just that, but those efforts were largely unsuccessful as the offices either could not or would not provide the information, or in many cases had no idea what the person was talking about when they said provider-based facility. They face that same frustration when trying to get information from their insurance companies regarding how the fee would be covered. So there you have it. That's pretty much wraps up the information I have regarding this issue. Again, I'd like to thank Kevin Kavanaugh and HealthWatch USA for asking me to speak, and I'd be happy to take any questions.